With new CDC guidances and new masking requirements at schools, many parents may be wondering what's the best thing to do right now to keep their kids safe in this new phase of the pandemic. This morning, we're joined by Dr. Joe McBride, an infectious disease expert with UW Health Kids in Madison. Dr. McBride, thanks for joining us.
Good morning. Thanks for having me.
Yes, of course. Jumping in, our first question, when do kids still need to wear a mask right now despite these new guidances?
Yeah, so people who still require to wear masks are people who are immune compromised, people whose immune system is not as robust as the average individual. Also, people who have been exposed to COVID should be wearing a mask for 10 days after the exposure. And then lastly, this is also incredibly important too, there has been liberalization with guidelines on when people who are positive can go out in the community. And that really is dependent on wearing a mask. So after someone is positive, 5 days of isolation at home needs to be followed with 5 days of mask use outside in the community. So those are at least some initial guidelines that people should consider.
Very important guidelines. And when it comes to prevention, what else and when can kids 5 years old and younger get the vaccine?
Yeah, great question. This is something that's been really in development for a while. When we do vaccine studies, an easy test for us to assess how immune system responds to the vaccine is measuring antibody levels. And this certainly is not the only way that a vaccine works with the immune system, but it's an easy one to measure. When the children younger than 5 had the vaccine trials, they did not have as robust of an antibody response as anticipated and hoped for. If you really tease out the data, the younger kids, 6 months to 2 years old, had a pretty good antibody response, but the older kids didn't. And so what that essentially means is there's going to be questions about dosing and how many doses are needed in this age group. And that is still being studied right now. So we're really hopeful that this will be an option soon, but the data just doesn't support its release at this point.
And finally, what should parents do given this new CDC guidance?
Yeah, well, I think an important thing to really stress to families is that this is here, we know it's here, and things are going to be ever evolving and changing. And that can be frustrating when I was on a program a month ago saying, goodness, you really need a really well-fitting mask. And now we're saying, hey, you don't really need one in a lot of situations. What this reflects is the ever-changing environment of the virus. Sometimes the transmission is high. Sometimes we have high numbers. Right now, we don't. And so recommendations are going to change based on the realities of the virus. So a word of caution or of recommendation is allow public health officials and physicians to be flexible with their recommendations as the realities of the virus always change. Think of it almost as like the weather, right? Some days it's an anticipated stormy day and you need a coat. Other days it's an unexpected beautiful day and you don't. And a lot of these mask thoughts and recommendations will be similar to that.
Yeah, that's a great comparison there. Dr. McBride, thank you for joining us this morning.